It's good to everyone here today. On behalf of Representative Forbes and myself, we're pleased to present today a public option. 72,000 Iowans will only have Medicaid insurance as an option come January 1st, which Money Magazine yesterday indicated is a 69% increase for Iowa for a silver plan, which is the highest cost increase in the nation, according to Money Magazine. Average nationally was that the plans went up 34%. As most of you are aware, Governor Reynolds and Commissioner Oman had proposed a stopgap measure, and for whatever reason, the Trump administration inserted itself in making sure that plan was not approved, so that leaves more than 72,000 Iowans without real options as it relates to their health care. One of the things that disappointed me was when Governor Reynolds indicated that she was blaming Obamacare for pulling the stopgap measure. And last time I checked, the GOP controlled the United States Congress, the United States Senate, and the White House. And certainly, I think that we've all watched Congress ditter, delay, and fail at the efforts towards improving our healthcare system. In Iowa, Republicans control the House, the Senate, and the governorship, and they've yet to put forth a meaningful example. In Mason City, I received an email from a couple that have 3 children. They're an Iowa couple currently paying $1,300 per month for Wellmark Blue Cross Blue Shield with an $11,000 annual deductible. Under Medica, that family will be forced to pay $2,261.95 a month with a $12,000 deductible and a 20% co-insurance once that deductible is satisfied. They have a 5-year-old, a 2-year-old, and a 1-year-old, and they can no longer afford to insure their family. So these are real Iowa families, and these are real Iowa families that are going to be hurt by not having a plan. What the public option will do will provide people between 138% and 400% of poverty an option to buy into the Medicaid system, and I'm going to let Representative Forbes talk a little bit about that.
Thank you, Senator McCoy. I'm State Representative John Forbes from Urbandale. I've been a member of the Iowa House for about the last 5 years. I serve on the Human Resources Budget Subcommittee, which oversees our state Medicaid program. And I've had some concerns. Back in 2015, when the governor first announced a change from going from a fee-for-service state Medicaid plan to a managed care system here in the state of Iowa, I was intrigued but concerned. And serving on that committee for the past 5 years, I've had the inside knowledge of knowing how our state Medicaid is run. And Iowa Medicaid was one of the best run, most efficiently run programs in our country, and was dismantled about 18 months ago. And so we want to work on a bipartisan way with both colleagues in both House, Senate, Democrat, Republican, to craft a bill that will be good for Iowans. The current system, as you know, has some problems. And when we started back in April of 2016, I was willing to give it a chance. As you know, we had to delay the program 3 months because of issues getting the MCOs up and running. But after 18 months or more of being in the managed care system in the state of Iowa, it's not working. As a healthcare practitioner, I get on a daily basis calls and emails from people all over the state of Iowa experiencing negative effects on the program, both from the patient side and from the provider side. And in many cases, we're seeing providers go out of business, especially in the rural areas of our state, because of inadequate payments or no payments, because the MCOs are not working with them on a daily basis. So we're putting forward a bill that will take us back to our old system of Medicaid prior to April of 2016. The state of Connecticut has done that, and they've seen a increase in services and provider satisfaction, and we think the state of Iowa should move back to a system that works for all Iowans. So our bill will hopefully get bipartisan support, and we're going to be introducing that bill very soon, and we hope that we'll have some positive reaction. Now, we know it's not perfect. We know that there will be hopefully modifications to make our bill better, and we're willing to work with both Republicans in the House and Senate to craft even maybe a better piece of legislation. So with that, we'll take questions.
So this would not help people buy policies for 2018, correct?
Probably not, because we won't be going back into session until January of 18, and so we'll have to work on this hopefully in the early stages of our session.
Is there any state that has gotten a federal waiver for this type of program?
No, Nevada passed this bill, and it was vetoed by a Republican governor. But this is something that I think is it's similar to what they're trying to do in Washington and what more than 26 Democratic senators have signed on to, which is a Medicare for all. This is in essence a Medicaid for all that would want to participate in this public option.
How much would the premiums be, and how does this help people over 400% of poverty, who are the exact ones who are hurt, right? They're the 20,000 that are at risk right now.
Well, our thoughts, now we don't have any actuarial tables that work. This is one of the first stages of this legislation. But we know that the administrative costs that the MCOs are charging the state are probably about 5 to 6% higher than what we were paying prior to moving to a managed care system. And if you do the math on that, it's probably about a $200 to $300 million difference. So the state of Iowa, from our calculations, we ran our state Medicaid program for about a 4%, maybe 5% administration cost. The numbers we're seeing from the MCOs are anywhere from 6 to 11%. So if you do the math, we think we can probably save the state around $200 million or more by moving back to the system we had in place, a fee-for-service system. And by doing that, we think the administration costs go down where we can be competitive in the marketplace to provide insurance to these people that are even over the 400% poverty level, to be able to buy into our state Medicaid program and probably be lower than the 67 or 69% increase that has been projected for Medicaid here in the state of Iowa, which will go into effect January 1st of this coming year.
What's your level of optimism that this can be supported in a bipartisan way and that the governor won't just veto it?
Well, that's what we're going to work on now. The work really starts now for us, because we have to go out and sell this to Iowans. We have to sell it to our colleagues in our caucuses, and we have to sell it to colleagues in the Republican caucus. I've had discussions with at least one Republican in my chamber that is really interested in taking a close look at this. So I'm hoping that we can move forward on a piece of legislation early in the session to provide adequate insurance coverage for the Iowans, and especially the 20,000 Iowans that are going to be out in the cold, or they're going to be at a point where they're not going to be able to afford, as Senator McCoy said, the co-pays, the deductibles, co-insurance, and things like that. Because, yeah, you might be able to afford the premium at about $2,000 a month, but you can't afford to go to the doctor because your co-pays and deductibles are so high you can't afford.
Have you talked to the committee chairs? Do you think this will even get a hearing?
Well, obviously, it's up to us to push this issue. We're in the minority. We're going to continue to advocate for this because we think it's sensible. And quite frankly, looking at the state budget and some of the challenges that we're going to face, as well as the new demands on our system for increases in funding for Medicaid as it relates to the privatization of the MCOs, I think they're going to have to be open to new ideas. What we have is failing Iowans. The privatization of Medicaid is a complete and utter failure, and it has to be changed. We can no longer go forward with this current system of privatization. It is not sustainable for the state, It is not sustainable for the individuals that rely on the programs, and it is not sustainable for the providers, the hospitals, the communities that serve these vulnerable Iowans that need the care. And so we know that it's going to be a painful discussion, but it needs to happen, and we're prepared to do it, and we're prepared to roll up our sleeves and admit that we have a problem, and if we can put forward this solution, we can begin the discussions.
Just to make sure I understand too, if this gets somehow passed, it also then requires approval from CMS through a waiver.
1132 waiver, yep.
Okay, you referenced
Or
13.
1332 waiver.
So bringing Medicaid back under state control, that's removing this privatization. That's huge. Isn't that something that could sink this effort, or do you think that these have to go hand in hand? There would be some who argue that the privatization of Medicaid is a whole other can of worms compared to this option for these 72,000 Iowans.
Well, the only option we have is to allow, if we went back to a state-run program like we did prior to April 16, we would be able to then have the hopeful that we can get this legislation looked at very early in the session and hopefully get buy-in from both chambers, Republican and Democrat, to get a bill passed and signed by the governor. And that process, and once we do that, then you have to go through the waiver program, which can sometimes take, 30, 60, 90, even maybe up to 6 months before CMS will either approve or disapprove of your waivers. So it's not going to happen overnight. Realistically, if our ducks fell in a row, we're not looking at offering this program to Iowans probably till mid-2018. At the soonest, if things go through the legislature.
And just to make sure, I know that you gave an estimate about $200 million in savings, but do you have an estimate on how much this whole process would cost?
Right now, our state Medicaid program is about a $4.2 billion program here in the state of Iowa. It's a lot of money. It's federal matching dollars. It's about $1.8 billion are Iowans dollars, and $2.2 billion of that is federal matching dollars. The thing that's nice about this program is the people that are at 138 to 400% of poverty will still be able to use the ACA cost sharing and money that the federal government will do to help them buy down premium. If you're above the 400% poverty level, you will not get any federal help. So the cost there really is very minimal cost to the state to implement this program, because we have the money right now from the federal government that's being used to buy down co-pays, deductibles, and buy down their actual insurance out-of-pocket costs. So from that standpoint, we don't see a huge impact on the state budget.
But moving away from the privatization of Medicaid to a state-run program, there are some startup costs there. Is there any kind of estimate on what that would look like?
That's, like we said, we're right at the early stages of this legislation, and those we'll get figures from the Department of Human Services to try to see where the cost would be involved in getting our program up and running again. As you know, we just shut it down about 18, 19 months ago. So we have a lot of the framework in place, but there will be some costs in getting it up and running again here in the state of Iowa.
What are the Vegas odds that a Republican governor running for re-election in 2018 would backtrack on something her administration that she was part of? Obviously she wasn't governor, but she was part of it for the past 18 months. Why would she backtrack on privatization?
I think this is one of, she goes into the campaign, the current system is completely mismanaged. It is a disaster in terms of what they owe providers right now, and providers are literally going bankrupt. They've exhausted lines of credit, and quite frankly, the claims process is a nightmare for individual providers that are filling out and submitting claims to 3 different MCOs. The MCOs have negotiated an unspecified amount of money for a risk corridor, which is, I'm told, is in excess of $150 million that the state's going to have to come up with additional funding for. And I think that we have already proven that this system has not saved Iowans a dime. This system has failed Iowans, and people are literally dying as a result of not being able to get services that they need, vulnerable Iowans to live. And so the fact is that if Governor Reynolds is politically aware and is hearing from the same people that we're hearing from, she can't go into the next election without proposing changing the system.
Best case scenario, if this bill gets passed and then the waivers approved by mid-2018, like you said, at the very soonest, would then Iowans be able to enroll immediately, or would there be a waiting period after that?
That's to be determined. I mean, we'd like to get the system up and running as soon as possible. Even once we get it approved by CMS, you're looking at probably another 90 days past that to set up the programs and things like that for people to enroll. So realistically, you know, we're probably looking at, with everything in place, you know, close to a year. This may not be able to be offered until 2019 because we got to go through the process, legislative process, the governor signs, and then we have to get CMS approval, and then the insurance underwriting part has to be put together also.
So, I'm one of the 32,000 people that are affected by this. You mentioned people from Mesa City that wrote you a letter that has high premiums and high deductible. I have a higher premium and higher deductible, and my insurance company has canceled me for this coming year. And I want to know what I'm going to do for insurance in 2018. What am I going to do for insurance in 2018? I don't care what the Democrats have done and the Republicans have done. I want to know what's going to happen because I'm faced with no insurance. Political politics aside, you know, the president said that we're going to have out-of-state providers. You know, who are they? Who can I contact? Okay. You know, I'm you know, in a situation where I retired and my employer canceled my insurance because I was supposed to go on Obamacare. Okay. Well, that didn't work because it was supposedly cheaper. Well, it's not cheaper. It was higher. And now I'm in that gap of people that all the providers have canceled. Okay? So what am I supposed to do? I just need an answer to that.
Well, the only option you're going to have in January of 18 is the company called Medica. And as far as I know, they're still in the marketplace.
Okay.
And I know it's going to be very expensive.
I looked up Medica online the other day. And just as you said, my premiums are going to be $24 a month. My deductibles are going to be, for me and my wife, are going to be $13,000 a month, and then a co-pay beyond that. For this year, I spent $24,000 out of pocket already, between premiums and deductibles and out of pocket. I spent that already, okay? And you know, I'm going to spend what, $40,000 next year? I mean, I'm better off going self-insured. Okay, you know, that's the other issue is these healthcare providers, they have these contracted rates with the insurance companies. Okay, why don't we all have the same rates that the insurance companies provide? Okay, I had a procedure, and I was the health insurance company billed the provider billed the hospital billed the insurance company $116,000. Okay. The insurance company paid $16,000. Okay, so why can't all of us pay $16,000 versus $116,000? Because they have a discount rate of $100,000. Okay, I mean that isn't fair. You know, I've got lots of friends that are government and state employees. They get insurance for $20 a month. Okay, why are they the elite citizen versus people like myself and all these people that are working in the private sector, and they get all this insurance that is discounted, or you know, you all get insurance perks. The state government all get insurance perks. The federal government all get insurance perks. What about the business people, you know, that work that aren't that elite class of citizens?
Well, that's why we're here today. After the governor pulled her program with the insurance commissioner, we thought we'd step in now and have another option for people to look at. And I know it's very expensive insurance.
What have we been doing the last year or two? We've noticed it's been coming.
Well, we're hopeful maybe that the insurance commissioner's plan, the stopgap plan, would maybe get approval.
I waited for that. I waited for that.
I know.
Yeah,
And Matt and I both attended meetings with the insurance commissioner.
Yeah.
And tried, you know, we actually gave some input. And unfortunately, for some reason, whether it's CMS or what happened, we're not sure. It had to be pulled because of issues with
I don't care about that.
Trump
I just read it done.
I understand that, and that's what we're offering today is an option. Unfortunately, it can't happen without Republican approval. You don't care about whether it's a Democrat or a Republican issue, but I'm here to tell you the Republicans in Congress failed to deal with this issue. As a result, the Trump administration has been systematically disassembling Obamacare. They have shortened the enrollment period. They have lowered the standards for the time approvals for people to wait to go into the program. And as a result of their inaction in Washington, we're here in Iowa saying we've got to do this because we're leaving all these people out here uncovered. And we understand your situation. We understand why you're frustrated. We're frustrated too. And we want to change this system. And we're here to say we're going to put forward a plan that has a lot of audacity to it, because it's saying, first of all, our current system isn't working, and that we've got to change this, and we've got to have a public option. Americans really have been asking, in your situation, for a universal coverage, for some kind of system that everybody pays in the same kind of rate, single-payer system. We're not there yet, but this public option will move us closer to that goal. But we've got to start here. There's a proposal in Washington, Medicaid for all, Medicare for all, in Washington right now that 26 senators have signed on to. So they're moving in that direction. But it's going to take time. And unfortunately, you're in a position where you're a victim of this inaction. And so we're putting forward this idea. Best case scenario, we would have this up and running in the January of 2019.
You know, I know you white and Republican, that sort of thing. Like I said, I don't care if it does it. I really don't. Okay?
I understand.
But in my situation, it was Obamacare that affected my employer's decision to cancel my retiree insurance, because they canceled me, well-known company canceled me, because I could get Obamacare for cheaper. So they made that decision based on Obamacare. Well, that wasn't all true, okay? And now my employer would have kept me on the retiree program, I wouldn't stand here today, okay? But they made that decision based on Obamacare, okay? And now I bought private insurance last year and a half, and now I'm being canceled because I'm in this situation.
And honestly, if Congress would have made the changes that they needed to make to shore up Obamacare in this year's Congress, you would have a competitive plan being offered to the marketplace, to the exchange. But they did not act. And that was a Republican decision made by a Republican Congress and a Republican president. And that is unfortunately the condition we're in today.
Yeah, we're in a condition where no one's getting anything done.
I understand that. I understand that. And that's why we're here in Iowa saying we can lead the nation. We can lead the nation out of this malaise that the Republicans have us in Washington. We can lead the nation out of the chaos that it currently exists, because we're Iowans and we're creative and we have a plan. and we're putting forth this plan, and we're asking for our colleagues to join us, and many of them have, to push this through.
I kind of thought this was going to be for a solution for 2018, so obviously.
Yeah, I understand.
I have a follow-up question, just to make sure I understand. What kind of support do you have within either the Democrats or Republicans, if you could be specific?
Right now, in my caucus in the Iowa House, I have about half our members have signed on to the bill, and I have
The House or half the?
half the Democrats in the House. So I have about 20 co-sponsors right now, and we're going to probably have more. And so we're going to pre-file the bill sometime in the next few days, and then that'll be on record. And I think at that point, I think we'll see more of our colleagues, sign on. And I'm hoping, that some Republicans too will take a close look at this and really see how this would help move our state forward in providing quality care to Iowans that really need it.
I've had 6 of my colleagues sign on already, and about half of them want to take it to their town hall meetings and their constituent meetings and share it with their constituents and get their feedback. I think before we're all said and done, we'll have the majority of our caucus.
You said 6 Democrats. In the
6
Senate.
Democrats signed on. We just had caucus, and 6 signed on at caucus, and in addition to myself, and the majority of them wanted to take it home and run it through their town hall meetings.
So, question, Matt, or to John. For people buying into Medicaid under your proposal, above 1%, so like this gentleman that had this huge premium increase, we know Medicaid came in about 40% higher from last year, and then they went up to 57% because Trump cut the subsidies. How do we, or do you know yet, in terms of buying into Medicaid, how those premiums would compare to what he's paying? And if not, how do we get those numbers?
Well, Rick, we, like I say, we're right at the early stages of this bill, and so we don't have any actuarial tables available to us yet, but we know that we feel as though we can run our state Medicaid program at a lower administrative cost. As I said before, we're looking at, if you look at what it costs, a 5% administration cost compared to maybe close to 10%, it's about a $200 million difference. And that's dollars that could then go back to provide services to people here in the state of Iowa, instead of paying the these large MCOs and their CEOs their large bonuses and payments and things like that. So we think that $200 million would be much better served providing care to Iowans than going into the pockets of the MCOs.
Would a larger risk pool also lower that cost? Because
Yes.
right now you got 70,000. Obviously, if they're combining with the Medicaid folks, is a much bigger pool. Would that help us as well? Risk pool?
Yeah. Negotiated rates, first of all, under Medicaid would be much lower than through private insurance. So you get the volume purchasing volume. So you're working at the same kind of contracted rates. In addition, you would also have the ability then to negotiate directly with providers because you're a big pool. And the healthier people you have in your pool, which is why we call this Healthy Iowans for a public option, the healthier your pool is, the lower your rates are going to be because you're spreading the risk across a whole population of healthy people. So your costs are going to be substantially less. We can't give you any figures today, but we can tell you it will be a lot less than it is. And I think Iowans ought to be asking the governor right now, why is Medicaid's cost 69%? And why will that lead the nation? Why is it double the national average? Because the national average is a 34% increase. Medicaid is a 69% increase, according to Money Magazine, is what they predicted. And so the question I have is, why has that happened in Iowa? So something's not right in our system.
President Obama originally had a public option in Obamacare, and he dropped it because he couldn't get it through a Democratic-controlled Congress. What makes you think that a Republican administration would go along with it nationally? And Is there anywhere in the country where a public option like this has gone through?
We're not aware of any.
It passed in the Nevada legislature, both the House and Senate, and wasn't signed by the governor. But I think the times have changed since President Obama proposed a public option, and I think people have continued to see this whole healthcare crisis spiral out of control to the point now where I think Republicans need to come to the table because they have not put forth an idea or an alternative to Obamacare. There's not a single alternative on the table that Republicans have put forth. So if they want to put an idea out there, we'll look at it. Any idea. But right now they're not even talking about it. They're talking about tax cuts for the richest 1% of Americans.
I have another follow-up question. The division section on the terminating the managed care Medicaid program is like a paragraph. And so I'm curious if the bill that will be filed in a few days will have more information about this, because I can see the argument where that's simply not enough information to do that. It's a lot more complicated, obviously, than that. So do you expect this just to be the general framework of the pre-filed bill, or do you expect more information with that bill?
Right now, the bill, that's the form that will be pre-filed here soon. And like I say, we're going to work with our colleagues on both sides of the aisle to try to perfect the bill, make it better. And I know there'll probably be some modifications and changes, but the general framework of the bill is we want to go back to our old system of Medicaid here in the state of Iowa. Like I said previously, that worked well, was a model for many other states to emulate, and we want to make sure that we can provide adequate services to Iowans. And if you've been reading the paper and the media, you know, we've had some issues with some people in Iowa who have died because of lack of or cutback in services. So we want to shore our program up, go back to a system that was functional, workable, and worked for many Iowans. Now, it wasn't a perfect system before we went to MCO type of systems, but we know that we can work with the departments to make a system that all Iowans will be proud of.
So just to follow up on her question, Branstad made this arbitrary decision to go to privatize Medicaid. He didn't ask the legislature and didn't get approval from you.
Correct.
Why couldn't Reynolds move it right back to where it was before?
She absolutely could. She could do it tomorrow, and I think she should. If I were giving her political advice, I would tell her to head in that direction.
And then we would be able to start the process now of getting the waivers from CMS and maybe speed the process up by maybe 6 months. But that's the governor's decision to make.
Yes, sir. Joe?
But until we get to the idea that everyone's entitled to, as a right, adequate and affordable care, what you do and what others do is simply moving numbers around. Until people are convinced that this is a universal need, it doesn't it still gets to the impasse. And what can you do to bring about that consensus? Because once that is arrived at, then you can put the numbers in and they'll work. But until that happens, we just shuffle the numbers around.
You know, I think that's the argument for universal health care, and I think that a single payer system where everybody's provided health care based on their ability to pay, and we have a national system. We're not there yet. We're not there yet, and until we get to that point, we're going to continue to struggle with how we provide coverage. 2/3 of Americans get their coverage through their employer. 2/3 of Iowans get their coverage through their employer. That means 1/3 of Iowans are either relying on a Medicaid system, or in this case, the system that's subsidized, or they're being forced to go out into the marketplace. And that is really what we're working towards, covering that 1/3 of the system. We're saying that by privatizing Medicaid through using these MCOs, we're failing Iowans, and we need to fix that. And we also need to provide a public option for those people that are being forced into the marketplace to buy insurance. And that's what we're doing today. We're dealing with those 1/3 of Iowans.
And I'd add,
I think one of the things that you might not be considering or overlooking is my husband works at Hy-Vee, and I was at their benefits meeting yesterday, and Hy-Vee is implementing a lot of changes to their plan that are more reflective of the bullshit that we're getting from Washington and, situations that we've heard about here that are just totally untenable. And, I happen to be HIV positive. I've been HIV positive for years. I've never been sick. I've always had great care, great medication, affordable. That is going away. And I have to think about my own mortality every single day, because if I can't afford my medication, 3, 6, 12 months from now, I'm dead.
well, going back to the previous question, Senator McCoy alluded to 1/3 of the population. Right now, currently in our country, we have about 75 million people on our state Medicaid programs across the country. 55 million are on our Medicare program. So right now, we have about 1/3, or a little more than 1/3 of our population on single payer. And and really, it's not working too bad. I mean, it's got a lot of problems, but when you think of it, 1/3 of our population or more is on a single payer system in this country now. So we're not here advocating that we need to go to single payer at this time, but I think this program, what we're talking about today, moves the needle a little bit further that way, where we can provide adequate insurance for the 20,000+ Iowans that are going to lose coverage or not be able to afford insurance after the first of this year. So we're here to help find the solution. We don't have all the answers right now, and that's why most likely in the next week or two, we're going to go out on the road and we're going to talk to Iowans and propose and let them hear from us, let them hear from their legislators in their districts to try to see if we can perfect the bill, make it better. We're not insurance experts. I'm a pharmacist, but I'm not an insurance expert. And I know we're going to work hopefully in a bipartisan way, again, as I said, to be able to get a bill that will do best for the state of Iowa and all Iowans who are on our state Medicaid program and people who fall into the gap where they can't access affordable health care.
Yes.
I have a question. Your focus right now is, Senator McCoy, you said 1/3 of Iowans that fall outside of this, because 2/3 are covered by insurance through their employers.
Right.
But those 2/3, that situation, as this gentleman mentioned here, that's really not an idyllic environment either, because what you see is employers scaling back their share of the cost of premiums, or the policies are getting higher deductibles, things like this. And I think a lot of small businesses, especially, are under the burden of trying to manage health insurance for employees when they have a lot of other things to worry about to stay in business. Is there a way for your proposal to provide an option for people who are employed and have insurance through their employer to get it through a public option? Or is there a way for you to offer employers themselves some relief so that instead of having to go to a private insurance plan for their employees, they can tie into a public option health insurance plan? Because I don't think, to me, the most acute issues are, like this gentleman here, as a patient, shouldering the cost of insurance, of co-pays, of deductibles, all as an individual. But these cost burdens are everywhere in the system, even with large employers, mid-sized, small employers. So is there a way to broaden your proposal so that, to me, I can't figure out why companies across this country, why businesses don't embrace some alternative to the status quo of them being responsible for for health insurance for their employees. We're the only industrialized country in the world that has this as the fundamental building block of our healthcare insurance system, and it's asinine because it burdens companies and it ends up, I think, hurting a lot of individuals, both who are employed by those companies, because those costs get passed on to them in the form of lower wages or shrinking benefits and things like that, or they get the problems go to people who aren't employed. Is there a way to expand your proposal to, I guess?
You know, I agree with most of what you just said, and unfortunately that isn't what we're dealing with today. I mean, we're really just trying to figure out how to get coverage to the uninsured Iowans that are currently outside of the Medicaid system, the subsidized system, and we're trying to give them a public option. Now, we know the vast majority of the people that are going to be impacted are self-employed entrepreneurs, small business people, and farmers. And we know that there's a lot of farmers that have qualified under the Medicaid system for subsidized care as well. Ultimately, what you're asking is a more universal question related to more, how are we going as a nation, and are we going to tackle this issue of universal care? And I think we've got 26 senators that in Washington right now that are moving in that direction. And I think that ultimately, as a country, we'll probably get there someday. But I think it's probably, it's probably going to rely on a new election and a change in public opinion, because we've had an election, and these are the results that we're getting as a result of the election. Elections have consequences, and that's kind of what we're dealing with today. Thank you very much. Thanks for having us.